Hi everyone, I'm Dr. Pranjal Jain, and today we are back with another episode of concising and compiling stuff for you to remember better for your need. Topic for today is Psychi Pharmacology. Okay, so Psychi Pharmacology को as a whole बस याद नहीं करना है, उसको आप 3 पार्ट्स में याद करिए. एंटी साइकोटिक्स, एंटी डिप्रेसेंट एंड एंटी मेनियाक्स, या उसको आप मूड स्टेबलाइजर्स कहेंगे, राइट? तो ऐसे 3 पार्ट्स में डिवाइड करो तो ब्रेन के ऊपर लोड नहीं जाएगा. We'll see how today. Main 3 parts हो गए psychotics, depressants and mood stabilizers. Psychotics are further divided into typical and atypical. क्या difference होता है typical और atypical में? Typical जो होते हैं they block D2 receptors, dopamine receptors, तो उनके साथ ज़्यादा extra pyramidal side effects दिखते हैं. जबकि atypical जो है they block D2 as well as serotonin receptors. So उनके साथ metabolic side effects हमको ज़्यादा दिखेंगे, right? Atypical में metabolic ज़्यादा दिखेंगे, typical में हमको extra pyramidal ज़्यादा दिखेंगे. Then antidepressants. Antidepressants are all your reuptake inhibitors. It can be your SSRI, SNRI, NDRI, कुछ भी हो. Reuptake inhibitors are your antidepressants. एंड मूड स्टेबलाइजर में एक ड्रग हम सबको पता है, दैट इज लिथियम. उसके अलावा कुछ एंटी एपिलेप्टिक ड्रग्स होते हैं, बट ओनली फॉर नेम सेक व्हाट वी यूज इज लिथियम. सो स्टार्टिंग ऑफ विद एंटी साइकोटिक्स. एंटी साइकोटिक्स के 2 क्लासेस हैं, हमने देख ली, टिपिकल एंड एटिपिकल. टिपिकल में क्या मोर कॉमन है? एक्स्ट्रा पिरामिडल साइड इफेक्ट्स. एटिपिकल में क्या मोर कॉमन है? इट इज योर metabolic side effects. ठीक है. To remember the drugs in each of these categories, we remember this car. What is this? This is a Honda City का car, right? So the drugs would be Honda City car. ठीक है. तो Honda City, haloperidol, chlorpromazine and thioridazine. These are the typical ones, whereas car, your clozapine, aripiprazole and risperidone, these are your atypical ones. So we need to remember one line about each of them, the line which is question worthy, which either has a PYQ or an FYQ. Okay, what are those? Starting off with the typical ones. Haloperidol. Haloperidol has max D2 inhibition, therefore max risk of extrapyramidal symptoms. The prototype drug for atypical clozapine, it has max serotonin inhibition, so it has max metabolic side effects like weight gain. For clozapine, you also remember it is an anti-suicide drug, but it is the last resort drug. Why so? Because of its side effects, which are, pause and tell me in the comments. Yes, agranulocytosis, a very deadly side effect, and that is why it is the last resort drug. Moving on to other typical antipsychotics, chlorpromazine, it causes maximum seizures. And atypical में aripiprazole का one point you need to remember is that it has partial D2 agonism. ये D2 एंटागोनिस्ट नहीं है, इनफैक्ट इट इज़ अ पार्शियल एगोनिस्ट एट D2. सो अगर किसी को बहुत ज़्यादा एक्स्ट्रा पिरामिडल सिम्टम्स हो रहे हैं, वी कैन गिव दिस. नाउ ये जो साइड इफेक्ट्स हैं किसी का EPS, मैक्सिमम सीजर एट्सेट्रा, वी शुड कंबाइन देम एंड रिमेंबर बिकॉज इट इज़ फ्रीक्वेंटली आस्क्ड दीज डेज. आई हैव डन दैट फॉर यू. सो इसी मैनर में 4 मेजर साइड इफेक्ट्स एंड उनके ड्रग्स आप याद रखना. Starting off with QT prolongers. QT के नाम में ही है Q and T. So you have quetiapine, thioridazine as well as ziprasidone. Okay. So you remember QT prolongers are QT, that is quetiapine and thioridazine. ठीक है. Now ophthalmological side effects. They are very important and they are easily confused. How we will remember this is cataract. कैटरैक्ट में क्या होता है? यू कैन नॉट सी, यू हैव अ क्वाइट आई, सो क्वाइट और क्विटियापिन यू विल रिमेंबर. रेटिनल डीजेनरेशन, आर से याद रखेंगे आप, क्या होगा यहाँ पे? थायो ridazone. Bacha verticillata. Verticillata is by chlorpromazine. So how you remember it is cataract, quiet eye, retinal degeneration, ridazine, and verticillata is by chlorpromazine. Okay. Then seizures, what did we see? Maximum seizures is by chlorpromazine. So we will add this to the table along with clozapine, deadly side effects. Stroke is a side effect of risperidone. Just remember this. Coming on to antidepressants. They are all reuptake inhibitors or RI we have seen, right? And the most typical TCS. Here also we need to remember what drug comes in each category and a special feature about the category as a whole. TCA are the pramines, imipramine, desipramine, etc. They have anticholinergic side effects, all these secretions they dry up, as well as they have CVS and CNS side effects. So you will have a patient who has a prolonged QRS, which would be a clincher for your TCA toxicity, and the antidote would be sodium bicarbonate. For SSRI, they are the drug of choice for everything else. You will study specific drug of choice for different diseases, and if you have not studied for some of them, it has to be SSRI. When in doubt, SSRI. So it is the drug of choice for everything. The side effects are sexual and GI. Acutely GI, but in the long term they can cause sexual side effects. SNRI, you have one prototype drug here, that is venlafaxine, but the major side effect here, it is blocking norepinephrine uptake, right? So it can cause a lot of catecholamines in the blood, leading to hypertension. So it is very good for severe depression, but a major side effect is hypertension. Last, NDRI. Here we do not play with serotonin. SSRI, SNRI, they all had something to do with serotonin, so they had some kind of weight gain. But NDRI or bupropion, it has minimum weight gain. Why? Because we are not dealing with serotonin here, right? And it is also used as anti-smoking. So no S's are there. Serotonin nahi hai, तो minimum weight gain. Smoking bhi nahi hai. That is all what you need to remember in a nutshell about antidepressants. Coming to mood stabilizers, and we need to remember only one in this, that is lithium. Lithium is repeatedly being tested these days and becomes very important. First, levels. When do we measure lithium levels? At 5 days post onset, 12 hours after the last dose. Now, for levels, you just need to know the table of 4. What is it? 4 ones are 4, 4 twos are 8, 4 threes are 12, 4 fours are 16. Cool. So for prophylaxis, the levels have to be 0.5 to 0.8, 0.4 samajh lo. For treatment, 0.8 to 1.2. And for toxicity, the levels are more than 1.5, 1.6. So 4 ones are 4, 4 twos are 8, 4 threes are 12, and 4 fours are 16. Make sense? Now, toxicity. What are the symptoms of toxicity? You will have GI as well as CNS features. Tremors, ataxia, vomiting. Now, it's difficult to remember specific features. Remember the systems which are involved. So, GI and CNS, some features of each of them would be there, and you would pick up a patient of lithium toxicity. What is the T half of lithium? It is 1 day. And what are the side effects? Fine tremors and nephrogenic diabetes insipidus. Coarse tremors, remember, are a sign of toxicity. If you can properly see tremors, then it is toxicity. But fine tremors, which you might not be able to see, are just a normal side effect. Last, it is the drug of choice everywhere except pregnancy. Why? Pause and comment. Right, because in pregnancy it is teratogenic, it causes Epstein's anomaly. So here the drug of choice is antipsychotics. So this in a nutshell is what your Psychi Pharma looks like. Just remember it as this half page: antipsychotics, antidepressants, mood stabilizer. Antipsychotics में what you remember is your Honda City car. Antidepressants are your RIs, and mood stabilizers is lithium and your 4 table. So I hope this sorts out things for you, makes Psychi Pharma bearable, easy to remember. And if you liked it, please give a thumbs up, subscribe and comment. Thank you.